Hi, my name is Luciana Solomon and thank you for taking the time to review my video. In this video, I'll be answering a few questions related to my knowledge and experience in the occupational therapy field. To begin, the experiences I have had that have helped me explore different OT settings and solidified my decision to pursue OT include observing Ms. Jane Rock-Gangow, an occupational therapist, in her scope of practice. Ms. Jane has worked in schools, hospitals, and early intervention home health. I was able to accompany her on her visits to different daycares and clients' homes for early intervention services. These observations have opened my eyes to what occupational therapists do and has allowed me to learn invaluable information about this profession. Each child is unique and has their own challenges and goals they need to overcome. Seeing how Ms. Jane plans each session with an individualized approach for each child was fascinating. For instance, there was one activity that involved organizing shapes into the appropriate slot to practice hand-eye coordination and fine motor skills. Most children were able to complete the activity with all the shapes pieces given to them at once. However, there was one child who got fixated on lining up the different shapes instead of putting them in the necessary slots. So Ms. Jane had to give him one piece at a time so he was able to successfully complete the activity at hand. Ms. Jane meets each patient where they are at and gives them the tools and support they need to achieve their goals, which is what I aspire to do in the future. It is as if Ms. Jane has a magic toolbox of skills and looks at each child's fine and gross motor, emotional, play, and social skills to help them. Seeing how happy each parent was when they saw their child achieve their goals really solidified my decision to pursue OT. OT can help all individuals across the lifespan with their own unique goals, and I want to make a difference in people's lives and allow them to live their own lives to the fullest. Moving on, a sense of belonging can definitely help participation in daily life. When someone does not feel like they belong, this can lead to social isolation and negative thoughts. I worked at Leapy Eye, an early intervention preschool, for almost a year, and I've worked with many young children who had a difficult time belonging. One student I worked with had certain sensory and auditory triggers that greatly affected the way he was able to participate in the classroom or in certain class celebrations. He would get upset and cover his ears when we sang happy birthday to students or said certain words like good job. It would sometimes escalate to the point where he would need to be separated from the group because he would disrupt the classroom. This definitely hindered his participation in daily life. Due to his triggers, he sometimes missed out on singing happy birthday to his fellow classmates, morning circle time with his peers, and playing outside in the playground. If he's not given the proper attention and tools to help him rejoin the classroom, this can further isolate him. After some more time in the classroom and his private OT sessions, some of this child's past triggers did not affect him anymore, and he was able to more effectively self-regulate himself in the classroom without needing to be removed. These new skills allowed this child to be more involved in the classroom and feel like he belonged, helping his progress even more. Now, in regards to the current societal issues OT can address, one of them is making restaurants more accessible for individuals with walkers. My boyfriend's grandmother needs a walker, and when I go out to dinner with their family, we sometimes run into many challenges in bringing his grandmother into the restaurant and ensuring her comfortability. At one restaurant, we were finishing up our meal, and his grandmother had to use the restroom. The only restroom available in this restaurant was located up a flight of stairs, which was completely inaccessible. Another situation included us not being able to enter an establishment because the only way to our table was up a small flight of stairs, which would not be possible. These occurrences are severely limiting and unfair to those with disabilities, as they should be able to fully enjoy themselves at restaurants just like anyone else. OTs can make an impact by making this issue more well known and informing others on these daily tasks that many people struggle with. Informing the public on this can help restaurants find ways to become more accessible for everyone. OTs can also develop exercises and activities to help those with walkers find ways to attend restaurants more easily. They can take trips to restaurants with their patients to practice this activity and allow them to become more involved with their life. Thank you again for your time and consideration. I look forward to hearing from you.